Erica, founder of MedHaul, and we make it easy for people with special needs to get to the doctor. Before MedHaul, I spent 7 years in clinical and research informatics, leading tech teams at some of the biggest names in healthcare, like Epic Systems, which is a $70 billion electronic medical record company, St. Jude Children's Research Hospital, and startup giant Flatiron Health. So, with my substantial experience, imagine my surprise and frustration when I couldn't even help my mother easily schedule a ride for my grandmother, who was a type 2 diabetic double leg amputee. We thought this was just a problem for our family in our small hometown of Greenwood, Mississippi, but I eventually learned that this was a problem for over 50 million families across the country. The problem is that there's just no easy way to book and manage non emergency medical transportation, especially for those with special needs. Looking specifically within healthcare, when patients, especially those with chronic illnesses like cancer, type 2 diabetes, high blood pressure, miss their appointments, it can be detrimental and even fatal to their health. According to Becker's Hospital Review, missed appointments and the overutilization of emergency services cost the U.S. healthcare system about $200 billion per year. Hospitals and insurance providers have made tons of attempts to provide transportation, but the processes for doing so are so outdated and ready for disruption. So there has to be a better way, right? We found that the bottleneck actually lies within these extremely dated paper and phone driven processes that health systems have used for decades. So we've taken our experience in healthcare administration, health information technology, population health, and software engineering, and we started building MedHaul, a mobile optimized platform to streamline the management of rides for those with special needs. MedHaul's technology connects healthcare providers like hospitals, clinics, emergency services groups to the best special needs transportation options so they can easily book rides for their patients with special needs. We found in our pilots that our solutions save time, reduce costs, and most importantly, increase patient and provider autonomy and empowerment. So our initial solution is B2B. We're a B2B marketplace with healthcare providers on one side and non-emergency medical transportation providers on the other side. We create a streamlined process for healthcare providers, helping them save time, reduce costs, and improve patient satisfaction. And transportation providers who live on the other side, these are businesses that already own their own fleets of vehicles and already have trained drivers. By being in MedHaul's network, they now have access to more revenue and provide tools to help. And we also provide tools to help with their business acumen, making them much stronger partner for us. The healthcare transportation industry is about an $80 billion industry, which is expected to grow to a $100 billion industry by 2026 with a growing baby boomer population. MedHaul currently operates in the private non-emergency medical transportation market, which is comprised of healthcare provider paid or self-paid transportation services. Our vision is to capture at least 5% of the private NEMT market. We're early, but we've actually been pretty successful so far. We've done over 7,000 complex rides to date through our paid pilots and contract customers, and we're on track to saving our first contract customer over $2 million within their first year of using our platform. We've also made a little over $106,000 in revenue. Our leadership team has over 50 years of combined experience in various realms of healthcare and technology. We've developed, selected, implemented healthcare IT solutions for hospitals and clinics across the country. Our experience has given us a direct lens into what our customers want and need. Our amazing leadership team not only has the professional experience, but the strength to execute quickly, which we think is the most important. However, we also have a very rich understanding of our large healthcare clients' needs because we've been the client, and we have an even deeper understanding of the communities that we target. We started with just an idea in only $70,000, and we got quite a bit done with that. First and foremost, we were selected by St. Jude Children's Research Hospital and several other hospitals looking for entrepreneurs to solve their transportation problems. That's actually how we got started. We completed the FedEx Logistics Innovation Accelerator, finished the first version of our software, We also launched our first contract customer, a government contract, which is one of the most difficult contracts to get, but we were able to attain a contract with the City of Memphis Office of Emergency Management. They use our platform to book alternative rides for patients who've called 911 but don't need a very expensive ambulance. So we're also, as I mentioned, on track to saving them almost $2 million just with using our platform in less than 12 months. What we're really, really honored and very excited about is to be one of the new 9 portfolio companies in Morgan Stanley's Multicultural Innovation Fund portfolio. They reviewed over 500 companies across the country, company stages C through Series B, and we are so excited and so honored that they selected MedHaul. We're so excited that they decided to join our journey. So you may be asking, aren't there others out there doing this? And of course there are. With a massive market comes a handful of competitors, which further validates that this problem needs to be solved. However, MedHaul's personalization, our scalability, and our southeastern urban rural focus poises our company to be a top contender in a market that is in its infancy. We've also seen that our primary competitors are burdened by slow customer acquisition, hiring their own drivers, or unprofitable business model. Our business model is simple: on a set number of rides. Our profit have fluctuated between 24 and 40%, and we believe we can get them to stabilize around 27 to 30% over the next 2 years. So we're scaling based on a data-driven go-to-market strategy. According to the Agency for Healthcare Research and Quality and the Robert Wood Johnson Foundation, 40% of Americans have at least one chronic disease. And in 11 southeastern states, 60% of the population has at least 2 chronic diseases, making this an extremely expensive region to treat for healthcare providers. Our immediate expansion plans include pursuing warm leads, and pursuing warm leads that we already have, and moving into new metropolitan areas as we sign new customers. More broadly, we're focusing on a 3-stage regional approach. The near-term Nashville, Charleston, Little Rock, Arkansas, and Memphis, and then moving into additional states in the Southeast thereafterwards. So MedHaul is planning to focus on growth on the specialized transportation market. So just to be clear, we're focused on special needs and complex patients. So we're currently raising $1.2 million to further commercialize our product and scale to additional markets. We have $600K in commitments, and we've actually just closed on $450K of those commitments. Our round is being led by Morgan Stanley and healthcare VC Inova Memphis. Our first close April 15th, and our second close, which will be our final close, will be September 30th. So really excited. Thank you all for this opportunity, and we look forward to hearing from you.